Hi guys, this is Dr. Patil here, medicine educator for PrepLadder NEET SS, and today in 1 minute we will be learning about a sign called Camptocormia. Okay, what is this? Okay, first let me tell you where do we see this. We see Camptocormia in patients with Parkinson's disease and some other disorders including old age, right? Okay, now what is Camptocormia? We all know in patients with Parkinson's disease, they have typically rigidity and hypokinesia, bradykinesia, right? So this rigidity in patients with Parkinson's disease particularly affects the axial muscles as well as extra-axial. So when we talk about this Parkinson's plus syndrome, it is primarily axial involvement. In Parkinson's, there is both axial and extra-axial involvement. And this axial involvement is more on the anterior group of muscles than the posterior group of muscles. That leads to a stooped posture because the anterior group of muscles are more affected than the posterior. So patient take stooped posture leading to curvature of the spine. This is also known as bent spine syndrome. And this bent spine disappears when the patient lies flat on the bed, and that is exactly what we call as Camptocormia.